McDonnell.
Thank you, Mr Deputy Speaker. Someone mentioned that this was a party political issue before. Let me just be clear. I opposed this system, but when it was introduced by the last government, I oppose it now. And the reason I did so then is the same as now, because I see it as a brutal attack on the weakest and most vulnerable in our society. And I also see it as an exercise by a private company to profiteer at their expense. I started raising issues very early on in Parliament, and my first constituent involvement was like everybody else. The first case I had was someone who's mentally ill, went for the assessment and then had a nervous breakdown. And it had an impact on the whole family, and his mother in particular. I was then contacted by a range of organisations, and they came together and they produced a report, the Spartacus report, and I urge members to read it. We read some of the case studies from the Spartacus report into the record of the last debate in Westminster Hall, and they're horrendous examples of human suffering and horrendous examples of what we can only describe as abuse by the system itself. But can I also refer members to Callum's list, which is on the website now. What Callum's list is a list of people who've died or committed suicide as a result of or where there has been a contribution by the loss of benefits. The first example on Callum's list when it started was Paul Reek. Some of you may know Paul. He was a writer and poet up in Leith in Scotland. He was an award-winning writer. He never left a suicide note. He just left on the table beside him 2 letters. One was the loss of housing benefit letter, and the other was the loss of incapacity benefit letter. He died. The other, let me just give the other example of Mark and Helen Mullins. They were walking. They couldn't access their benefits. They're in Bedworth. They were walking 10 miles a day to a soup kitchen, at the Salvation Army soup kitchen. They committed suicide together because they couldn't access their benefits. Read Callum's list, example after example of the brutal effect of this system. There's never, I think the level of concern expressed by members in the House today and in previous debates, because I think this is at least the 6th debate we've had now, is unprecedented about any level of public administration that we've seen in decades. Example after example of human suffering on a scale that is unacceptable in a civilised society. That's why 117 members of Parliament so far have signed the early day motion we tabled calling for the scrapping of this system. I've read Mind's briefing for today's debate, and I urge members to read it as well. They've put forward what's wrong with the system, and yes, they've recommended improvements. But one of the key factors that came out of their survey of people facing the W3A process is 51% of them said it made them have suicidal thoughts. Any system that involves that level of risk, I think, is irretrievable. I actually think it's unreformable. That's why I believe it should be scrapped now. And that's why the BMA have said it should be scrapped now. So I just say this, and I don't say it lightly. We know now the system doesn't work. We know the human suffering that's incurring. So the responsibility is now upon us to do something about it. And we will be to blame for every injury, every harm, every suicide, every death as a result of this system if we don't do something now to scrap it and bring in something that's fair, that's based upon proper medical knowledge, the assessment by a person's own GP, reinforced by expertise, and something that gives support for people when they go through a system, advice and emotional support, not something that leaves them at risk. So I urge members today, not just to debate. If you don't mind the honourable member, others want to come in, if that's okay. I just want to conclude on this. I think we all have a responsibility to say, let's end this system. Let's end it now. Start again and make something fair. Because we will be to blame if we don't. Blame for all that injury and harm if it occurs.
Evan Jones.